Hey, today we're going to talk about dizziness. Now, dizziness is a really vague term, not a diagnosis, but a symptom of something. And today, that's what we're going to talk about. A lot of people use the word dizziness to describe a sensation of feeling uneasy, off balance, feel like they're going to fall over, the room spinning, lightheaded, or like they're going to pass out. Lots of different ways to describe it. Now, when you go see your doctor, see how I used a bunch of different terms there? Use all those different terms because it helps us tremendously. So when you go and you say, hey doc, I'm dizzy, try not to use that word. That means a lot of different things. Try to use things like, hey doc, the room spins when I move my head when I'm laying down in bed. Or hey doc, when I go to stand up, I feel like I'm gonna pass out. I get the cold sweats. Another one I hear is, hey doc, started this new medication. Ever since then, I felt really off. Like I feel terrible. Something that my mama told me recently is, hey doc, I had my blood drawn. They did a little bit more than recently, and I felt terrible since. Along with that, try to line up when you felt this initially, what happened around that time, what you do to set it off, how long it lasts for, and any other symptoms you get. For example, do you get a headache when you have this happen? Do you feel numbness and tingling in your feet? Do you feel blurry vision or double vision? Anything else that could help us decide what's going on. But let's give an example. Let's say, hey, when I turned over in bed and I went to stand up, the room started spinning. It lasted about a minute, went away. I felt super nauseous. What do I recommend? Here's what I would do. I would see your primary care and I would have them refer to one, the ear, nose, and throat to have VNG testing done. They would look at your ears and I would hope that they would send you for vestibular testing. Now, if they say that everything looks normal and you get vestibular testing done with a PAT provider, I would have them refer to you neurology. We would probably do MRI of your brain. But that's how, in my opinion, things should run. And not just my opinion. That's how we would prefer it in neurology. Scenario number 2. They come and say, hey doc, I feel lightheaded when I stand up. I feel like I'm gonna pass out. This is how things should go. 1, you probably come to your PCP. Oh man, which way do I go? This way. 1, go to your PCP. They're probably going to do something called orthostatic vitals, hopefully. And they may send you to either cardiology or neurology. Here's a nice thing we call trail running. You get to walk the uphills. If you're actually passing out, we're going to do something usually called an EEG to make sure you're not having seizures. Now, usually for syncope or passing out episodes, this is going to come back normal. Because if you're standing up and you pass out, it's likely due to something called orthostatic intolerance or orthostatic hypotension, which we're going to defer back to your primary care provider or your cardiologist to help with that. Because it's likely due to medication changes, electrolyte abnormalities, low blood pressure, or low volume in your blood, which we can manage with conservative management, like fluids, other medications, something called Valsalva maneuvers, exercise, sodium, things like that. Now let's go back to our other scenario where I said, hey, you're finally at neurology. You've had dizziness, unsteadiness for years. You're like, man, I just can't get back to the bottom of it. Your brain MRI looks normal. You come back to neurology and you're like, hey, what's going on? That's not my ears. That's not my head. That's not anything. You may have something called functional dizziness. We also call this 3PD. You may have heard it before, but we also use venlafaxine, or it's the type of antidepressant for this, but actually helps quite a bit. Anecdotally, it helps about, I'd say 50 to 60% of the time in my patients and can be a real lifesaver for them. You want to hear a shocker? One of the most common types of diagnosis that can cause balance issues and unsteadiness, we've talked about it before, boom, Neuropathy. Remember what neuropathy is? Decreased sensation in the lower extremity, disconnect between the brain and the feet, telephone poles down from here down to your feet, no connection. Yep, it's because your brain doesn't know where your feet are going. Feet aren't telling your brain where it's going. Boom. Unsteadiness. Another common cause of balance issues, aka dizziness. So basically, what I'd recommend, if this happens to you, go see your primary care. You're probably going to get referred to ENT, cardiology, or neurology. And sometimes it takes a while to figure out what's going on. Don't be afraid to ask for a referral. Advocate for yourself. But I'd say one of the best places you can go to, honestly, is our friendly physical therapy office, who can do vestibular testing and really point you in the right direction. One thing you need to look out for, though, is if you have sudden onset vertigo, aka spinning sensation, room spins around you, if you have difficulty speaking, facial droop, difficulty walking, you need to go to the ER. Make sure it's not a stroke. Vertigo can be a symptom of stroke, specifically in the back of the brain, posterior stroke. So if you have vertigo with a combination of stroke-like symptoms, boom, go to the ER. Anyways, thanks again, guys. I'll talk to you soon.